So I'm Michael Barlev. I'm an anaesthetist from Dunedin in New Zealand, and I'm the Deputy Chair of the CPD Committee, and I'm here talking with Susie and Angus, who I'll let introduce themselves.
Yeah, hi, I'm Susie Lord. I'm a pain medicine specialist. I did train as an anaesthetist. I'm a non-Indigenous woman living and working on Awabakal and Worimi land in New South Wales, and I work with children and families.
I'm Angus McNally. I'm an anaesthetist. I work in Gadigal land, so in Sydney, and I am an Indigenous consultant.
Great to be here. I guess the purpose of this is with the new changes in the CPD program. One of the key elements that has been introduced is the cultural safety component, and there are a number of fellows from all over who are wondering what that is and how we go about doing that and the basis for it, things like that. So we'd toss some questions back and forwards, if that's all right.
Yep.
Did either of you have any questions or statements or things you wanted to start with?
I think it's important that fellows know that the cultural safety component of the CPD program is really about being professional. It's not about ticking a box, and it's an ongoing, it's not a small, short online experience. It's about really investing as a professional in continuous, so active, conscious and iterative learning about yourself, reflection, and making a commitment and being really accountable in our practice.
I agree. It's a journey from what I feel and perceive myself, and accountable to the people who will be defining whether we're providing culturally safe practice or not, which will be the patients.
Yeah. And I think it also spills into the experience of our trainees and our colleagues as well, because if we don't provide culturally safe training environments, then we can't have flourishing professional careers for our colleagues, and that's really important.
Absolutely. I think a big part of it is that cultural safety is patient safety. So, that's a big focus of what we've got to really look at.
The reflection component, why is that so important for cultural safety, say as a starting point?
I think if we're unconscious of our own culture and our own presence in the relationship with our patients and colleagues, and how that influences how our own culture and thinking and biases, things that we might be very conscious of and things we might be less conscious of, can affect other people, then we can't make change in ourselves. And so the first step is really consciously reflecting on who we are and how we got to be this way and what we want to change about ourselves.
That's a good point. It's almost like the CPD annual program in itself. The initial plan is a moment of reflection in ourselves from our learning journey, and this is a reflective component in a cultural journey. And
Well, absolutely. Susie got it right. There's unconscious bias, and it's prevalent in all of us. And unless we actually take the time to look, how do we ever know that they're there? You don't. And I think that's a big underscoring, like a core subject of what the whole cultural safety is all about, is identifying the unconscious bias that you might have that you're obviously completely unaware of. And you can only find that on like conscious reflection. And it is a process, and it does take time. And I think that now that we've got a yearly requirement that we reflect on our culture and on ourselves is fantastic. It's always going to make you every year, as you said, you reflect on your own practice as an anaesthetist. Why not reflect on your own culture and on your own cultural safety practices?
And certainly the reflective journey component, in my mind, it's not, as you mentioned, a tick box exercise. So if we stop looking at it as there's the box, I need to tick it, but even how do I do self-reflection? The process that one would go through to learn how to do that and then apply that to cultural safety that's still a learning journey, which you'll gain skills for other areas, but specifically for cultural safety. So some of the questions that get asked are, well, I've done this activity, now what? It's very much not like that. That's one activity, and that's one step towards the whole journey that you're going to take yourself on as a clinician in cultural safety. And I think when the mindset shifts to seeing it as a continuous learning journey, as opposed to one tick box, I'm done, now what? So perhaps some of the earlier activities, and certainly for myself, have not been, this is labelled as a specific activity that will get that done for you. The university in my home city has courses that are not specifically related to anaesthetics or CPD, but from a cultural perspective, to understand the interrelation between healthcare and Indigenous peoples. Other activities that you've done so far?
Yeah, so I took a bit of a personal journey with it. I think I called my family, I called my country, the people from my country, and I'm lucky, I've got them on speed dial on my phone, so it's a bit difficult for other people, but I called them, and it was just a reaffirmation of my culture and my heritage that I spoke to them about. I went back in depth over our history, and it's a very checkered history. Like great-grandfather was of the stolen generation. Mm-hmm. He had his rights he actively gave up his rights so that he could get married and have a home and have children. He married an Irish woman. So, for me, that is something that, personally, deep down, I want to do anyway. So I find that activity quite easy. As I said, I have them on speed dial. For other trainees, other consultants, other fellows, how affected were we today when, we had our welcome to country? How powerful was our welcome to country today at the ANZCA? And it was incredible. And to learn all, more language and more history about this area that we're in, I think it was quite powerful. And I would move people who were there not to feel that they didn't feel something about that. So, and that is easily accessible, I would have thought. I mean, we have Aboriginal cultural centres all around, or Indigenous culture centres all around Brisbane, all around every area, every city that we live in. It would be quite, you walk in there and you will be welcomed because, it's an active process that you're undergoing. And I think that any Indigenous or First Nations people that see non-Indigenous people proactively going about trying to increase their knowledge are incredibly empowered. Incredibly empowered.
You're right. And from an adult learning perspective, on the CPD program, we have knowledge, skill, and attitude. And attitude is a very large component of adult learning. And this ongoing learning, lifelong learning, is a big component of what we're looking at here. And the right attitude to this as a journey.
And I would say to fellows that there are, in every city, there are Aboriginal land councils. The universities will have a list of cultural education providers. And by way of an example, in 2023, I did 2 big activities and a lot of small activities that helped me. And one of them was going to the land, one of the 2 lands that I serve as a clinician, to the Warramai land, and to an immersive all-day workshop. And it's the entire content and day is run by the Warramai Land Council, and they took us to see sites and shield trees, and we learned how to dig fresh water from the sandhills, because this is saltwater country, but we drank the water. So we dug and we drank the water, and then they drew circles on the sand, taught us the old way about what's been lost: land, law, family and culture, and how, and in this traditional way of teaching, in this traditional space on their country, it was so powerful, and that learning will never leave me. Like, it was just phenomenal, and it was loving and giving. There's a sense, we all feel when we're learning about the history of the violent colonisation and ongoing policy damage that's been done. I think everyone feels some shame as a non-Indigenous person as well. How am I a part of this if I'm not doing something? And so, but I think feeling that uncomfortable feeling is really important for learning, and you can feel discomfort with kindness. And if you do that, and the people teaching in these courses are really wanting you to come to a healing place, a shared kind of reconciliated healing as a country, and I think it's wonderful. So connecting with immersive education would be the most high value. And the other thing I did was with the Australian Indigenous Doctors Association run a really intensive training program, and because it's run by Indigenous doctors, it is spot on for its applied cultural safety learning that you're practicing with problem-based cases in really relevant scenarios. So that's another high recommendation from me.
Absolutely. Fantastic. That
Thank you.
really good.
I have heard questions coming in saying, perhaps, how do I know if I do this activity, will that count as my tick box to have done for the year? And certainly there are library guides, ANZCA library guides. There's communication with the CPD team will help clarify those things for that purpose. But I think if someone were to embark on that and say, this is what I'm doing, even if it turns out that doesn't qualify, for want of a better word, as the CPD program's requirements here and now, the fact that individual has gone on such a journey and a passage and been proactive and has the attitude to go down that's beneficial. It's immeasurable,
Yeah, completely.
but it's beneficial.
Absolutely.
So the ANZCA and FPM CPD program focuses primarily on Aboriginal and Torres Strait Islander and Māori Indigenous peoples, First Nations culture. Why is that, if there are so many cultures throughout, that we focus on these first?
Look, if we just go back for a second, so we kind of use the words, what is cultural safety, and I think we should just go back a step from that and say, why cultural safety as the first thing. And why cultural safety is basically, to me, treat other people like you would like to be treated. And so if we go underneath that and say, and reflect on how we would like to treat people, it actually becomes that the way that I would treat people is based on a balance of my environment, my schooling, my parenting, all of these big things that make up my culture. And then on the other side, that your patient has gone through the same thing. And so your way that you would like to be treated doesn't always directly align with how they would like to be treated. And that is a very big part of First Nations thinking. So their environment, their heritage, way of thinking is quite different to how it might be on the other side in the health system as a healthcare worker. And within Australia, the First Nations were here tens of thousands of years ago. They were the first ones here, and then they've undergone significant, grievous harm, depreciation, everything. In fact, genocide, all of it.
Yeah.
And that is, that is a very real culture. That is a very real thing in Australia, and we need to, one, celebrate that, and two, know about that. So I think if that within Australia, how we focus so much on it, I think that is why it is important. We need to know this. We were fed lies all the way through primary school. We were fed lies all the way through high school. The whole thing was all just made up and all just given to you, and you just had to accept it, and then you did accept it. And then when you found out that was the truth, even in this day and age, you're being lied to about it. So it's, why focus on them? Well, that's why. It's just 350, 400 years of just complete and utter.
It's the right
push down, and it's and we live in Australia. We live on their land. Why are we not? That's the main focus of why we have to learn about it. Does that align with how you feel?
Yeah. And I think I've heard people say, well, what about people who've immigrated from other cultures? And for sure, there's discrimination and racism that people experience and disadvantage. But the really big difference is that immigration, people who've moved here, were not excluded from the legal system, from the education system, from the housing system. They didn't have their money, their income, their wages taken away. They didn't have their freedom of movement taken away, and they could choose who they married. None of that is true for a lot of our colonial history for Aboriginal and Torres Strait Islander people. So there is a difference. It's an important difference. It's very inequitable, and we have to redress it now. So that's why it's a priority.
And, absolutely. And certainly a lot of that would echo with the New Zealand Aotearoa Māori perspective, and the cultural safety term, so to speak, originates from, I believe, in the 90s of a Māori nurse. So it comes from a scholarship Aotearoa perspective.
Māori midwives, I think, felt unsafe in their practice, so they, brought this whole thing forward. So.
Certainly, and that was 30 years ago.
Yeah.
And we're still in it.
And it's a fabulous thing that it's mandatory, because it helps us. It's not forcing us, it's helping us to make it part of our professional development on an iterative, annual, not even just once a year, but every month we commit to doing something towards our plan. We'll be better doctors.
That's a very good point you raise in terms of what the CPD can offer the fellows, is this is mandatory from the council, MBA, MCNZ, and so the CPD program is trying and allowing and enabling fellows to embark on this as easily as possible, because it's not an easy task ahead. I understand there's a reconciliation component happening in Australia previously, now, currently. Are there things that you've seen or are aware of that are specifically addressing this in, say, the anaesthesia or pain sphere?
So for the college is working towards our reconciliation action plan. So we're working group members, and there are a whole bunch of activities and steps that we can do. We particularly celebrate National Reconciliation Week, which is coming up on the 27th of May through till the 3rd of June. That is a week that starts on the anniversary of the 1967 referendum, and this year it's a lot heavier, I think, because the 2023 referendum wasn't successful. So it's a week that starts by celebrating a referendum that was successful and gave people a lot of hope. So the theme for National Reconciliation Week this year is now more than ever trying to there's an enormous amount of ongoing and reverberating hurt from the no vote in Australia, and that's going to be felt for generations. I think people underestimate, and Angus can speak to this perhaps more, but from the people I speak with, it's a very significant year. So now more than ever, and also the theme of NAIDOC Week will also be about, not losing the power and the goodwill of all of the people striving to build a healed nation where we improve relations between non-Indigenous and Indigenous peoples for the benefit of everybody and improved and equitable health and lives.
Yeah, absolutely. Look, the no vote is such a trigger point whenever it's brought up. I mean, it's a really big trigger point for me, and it's a trigger point in that it's both incredibly sad and infuriating. And so now more than ever, I think really applies to the fact that the wind was knocked out of the sails of a lot of people who, there'd been 20 years of accumulation of all of this coming forward, and then there was this referendum, and however it was run, and the result came out, and it really I mean, personally, it knocks the sales out of me, and then to knock that out, it then stoked a fire. You know, it's now like, now more than ever, we have to come back from this. Like, it is, we either let ourselves fall back 20 years, or we fight and we go, no, we're not going back 20 years now. We're going forward, and there's just got to be messages put out, you know, from like, that is how we are feeling, you know. In regards to, you know, National Reconciliation Week, I'll be planning to be around a lot of my departments, running a couple of things. A lot of cultural safety will be discussed from my point. And then I really think a big thing that's, for me, that's really stoked is that I want us to be seen and heard now. And I think that we're going to try and get as many, you know, trainees and everyone into our programs as best as we can. You know, we did the Reconciliation Action Plan, which we all worked on and you know, we have points in that we need to get done, and we need to start properly doing them now. So I think there is going to be a lot of work within our own action plan as well over the next coming 6 months that's really going to, you know, I think hit people hopefully hard.
Yeah. And I think the more fellows who come along this journey, you know, it's a really, it improves us as people and as clinicians. I think Angus said, you know, good culturally safe care is high quality care, you know, safe care. So I just encourage everyone to think about what National Reconciliation Week means to them and means to their communities, that the people whose land they're on, how can they help the community to celebrate and continue healing. When I say celebrate, I mean mark this week and continue improving relationships, partnerships, and making a change.
Absolutely.
Now more than ever.
Now more than ever.
Well, thank you both so very much. It does sound like there's a lot for individuals to do, but as we've mentioned a few times, as a journey, it all starts with one step. So thank you for your time and for the conversation. It's meant a lot.
Thank you.
Thank you.